use this word cancer, and even prostate cancer, for a spectrum of biology that we are really only beginning to understand in terms of its complexity. The conversation is really not about you've got prostate cancer. The conversation is either you've got low-risk prostate cancer that is not a threat to you and we can do active surveillance and we're going to talk about your diet and your lifestyle, or you've got high-risk prostate cancer that we really need to have a very focused conversation about the next steps, including surgery or radiation or a combination of the two, or somewhere in the middle in terms of intermediate risk disease. You know, in many respects, a big part of my job is actually dealing with drawing people back from that cliff of the C word, if you will. You know, we use the word cancer for a lot of things in life, for this incredibly vast spectrum of heterogeneous biology. We kind of lump that all into this word cancer, right? And at one spectrum, we've got pancreatic cancer and lung cancer and these horribly aggressive malignancies that kill almost everybody diagnosed in a short time frame. And what I really try to stress is prostate is at the far other end of the spectrum. And even within prostate cancer, we see a huge spectrum of risk. Because there's a concept actually in my corner of this world of the prostate cancer diagnosis actually being a teachable moment for health in general. It is not at all uncommon that I've got a guy sitting in front of me who has 50-pack-year history of smoking, terrible diet, way overweight, all these risk factors for dying of a heart attack in the next 5 years, and one core of Gleason 6 prostate cancer. And all he wants to talk about is the prostate, and it's the last thing on earth he should be worrying about. And I always reinforce this point, which is a true statistic, that most men with prostate cancer die of heart attacks, because that's what kills most men in America, including those with the diagnosis. So it's not at all uncommon that the first time this guy has seen a doctor in the last 20 years is because some insurance company, life insurance company, told him he has to get a PSA test, and that led to this diagnosis, and now here he is.